This is the Investor Connect podcast program. I'm Halti Martin. I'm the host of this show in which we interview angel investors, venture capital, family offices, private equity, and many other investors for early stage and growth companies. I hope you enjoy this episode. Well, hello, this is Hal Martin with Investor Connect. Today I'm here with Jane Zhang, founder and CEO of Remmie. Remmie Health is a medical technology startup targeting the most common reason for a sick child visit, otitis media, ear infection, with 16 million episodes per year in the U.S. alone. Remmie's first product is an at-home smart otoscope that enables telemedicine and tracking ENT infections. This patent-pending device empowers parents to monitor ear, nose, and throat symptoms, and it can be used safely in the home. Jane, thank you for joining us.
Thank you very much. Thank you for having me.
Great. So what was your background before founding Remmie?
I am a biomedical engineer by training. So I went through in my career the whole life cycle of healthcare products. For early stage research and development, I built infectious disease diagnostics devices through my PhD in bioengineering from Boston University. And then I built automatic microscopes for tuberculosis as a senior scientist in Becton Dickinson. My specialty is actually diagnostics of infection and inflammation for the low resource settings, especially the home. I'm currently an affiliate assistant professor with the University of Washington on innovative diagnostics. So for the past 7 years, I have also dove into the early stage business development and launch preparation for large biotech and pharmaceutical companies. I worked as a management consultant for these companies in ZS Associates and helping these companies launch major products. And I led forecast and marketing analytics for Amgen as a senior manager in commercial strategy, forecasting, marketing operations.
Well, great. So what led you to start work in this space, and where do you think it's going?
Yeah. So you mean where did I start? How did I start working in this space?
Yes. How did you get started?
Yeah. So while I was focused on my career development or growth, as I mentioned, in large healthcare companies, my son was a preschooler. He had a tough year in the first year in childcare. He had 4 ear infections. For one of the episodes, it was just in the middle of the day, in the middle of the night. We had to go to the doctor 5 times and went through 3 different antibiotics. It took 40 days to resolve. His fever kept on coming back. So we just got rejected so many times for second opinion. We had antibiotic allergy. The doctor, and in the end, he told me to get closer to his throat and he showed me with his flashlight. He said, look, he didn't have an ear infection. It's probably started with that. But in the end, he had hand and mouth disease because of all the white blisters in the back of his throat. You should be able to see this. And at that moment, I was shocked because I just gave him antibiotics for 10 days for nothing. And also I didn't realize, I'm supposed to look in the throat by myself. So through this experience, I thought I needed a monitor for myself. And doctor said there's more infections in the next 6 months. He'd have to get an ear tube, which I kind of freaked out about because it's a full body anesthesia procedure. So, if I monitor him myself, I talked to my friends. I said, is this a good idea? They said, hey, it would be great to have a monitor, but it would be even better if I had a doctor connected on the other side to tell me how to use this device and how to interpret the symptoms. And what's more, if they can prescribe over the phone, so I don't have to go in the doctor's for an in-person visit. Given the pandemic that's going on, that would be a truly valuable add to the household, even in everyone's medicine cabinet. So I started researching. I couldn't find such a monitor, combining safety, ergonomics, connectivity to a doctor. So I took this idea through the part-time MBA program, which I would spend 3 years with UCLA Anderson School of Management, where I founded the company, filed patents, formed a team, and won pre-seed money to basically kick it off.
Well, great. So for those investors out there, what's your advice for them in investing in this space? What do you tell them to do before they write that check?
Yeah, I've talked to many investors in the space. One thing that I wanted to share is truly really invest in companies that are solving the pain points. At this point, families just would like to avoid doctor's visits as much as they can, by all means. There's also the other side of the problem, which is telemedicine and remote patient monitoring companies that are growing because of the pandemic, but they're also really looking for ways to increase customer retention, augment and enrich those patient experiences so that they truly mimic in-person visits. Without any tools like ours, the doctors are not able to provide those examinations. So that's so much pain points, but a lot of opportunities in the meantime. Also, if investors are interested in investing in digital health, they really need to look for a team with the right combination of skills and experiences in healthcare, technologies, operations, consumer products. And that's kind of folks who are experienced in both healthcare and tech, which almost sometimes run in parallel. But if there's a team that combines those experiences, invaluable perspectives from those worlds, that will be truly amazing. Those talents will cross-pollinate and amazing things can happen. So in our case, my partners and I bring vastly different perspectives on board. For example, we're able to think from the user's perspective. How would the physician like to interact with our product? What about a patient? How would we use, from a perspective of a technologist, right? How would we improve on their experience using our technology? What about user experience? What about value proposition with different stakeholders on the healthcare value chain? Because we truly bring value to consumers, and these are and physicians, healthcare providers, employers groups, payers, and most importantly, telemedicine companies. So these perspectives are truly important for a team.
So let's talk about the sector itself. What kind of growth rate are you seeing in this sector?
Yeah, so in terms of telemedicine as a sector or our potential customers, basically, they are surging this year. Last year, when we talk about telemedicine, people were laughing and saying, oh, that's like 0.05% of all total healthcare claims. This year, there's reports about 8,000% growth in telemedicine claims in April alone. And that represents from the companies that we spoke with, many of them are saying we're doubling, tripling, quadruple in size this year compared to last year because surge in customer demand for them. So that's one sector. Telemedicine is growing tremendously because of the pandemic, and there are 800 companies offering telemedicine services nowadays in the U.S. On the other side, we're also serving a customer that are basically children who suffer from ear, nose, and throat symptoms, and that's 5 out of 6 children before the age of 3 would have one episode, and before they're 7 years of age, 30 to 40% of the children would have recurring conditions. And that's not accounting for adult populations who we notice that many adults who have hearing loss or some sort of need for a regular hearing or ear, nose, and throat checks, allergy and everything going on with chronic sinusitis, for example. That's kind of amazing growth in the customers front for both companies as our customers as well as individuals. As a segment ourselves, the digital health space, it's very interesting. Those diagnosis assistance devices or monitors are just explosively growing this year as well. Last year, nobody would be buying kind of a consumer grade pulse oximeter. But this year, everybody is, even though you may not have a problem with pulse oximeter, your oxygen levels in the blood, many of my friends and families have noticed that it's helpful to have those tools in their first aid kit for prevention. So as a segment ourselves, diagnostic assistance tools and monitors, it's growing tremendously this year as well.
Oh, great. And so how many companies are engaged in this sector?
Yeah, like I mentioned, the 800 telemedicine service providers, and that includes healthcare institutions who derive their own solutions, healthcare companies who are providing those technology infrastructures, healthcare providers who are just leveraging Zoom to provide those services. And that's just a very big space where everybody is kind of trying to access patients and avoid in-person visits at this point. And there are also many companies building tools to enable those remote patient monitoring and telemedicine. I would say beyond the big players, there are also many others who are, like Johnson & Johnson, like companies who are providing solutions on a consumer basis. There's tremendous growth this year as well. I think these tools are basically needed to relieve the strained healthcare resources. And everybody's talking about, is telemedicine here to stay post-pandemic? We're just really, thinking that it is here to stay because it's truly changed the consumer behavior this year. But for it to remain relevant and competitive, and for people to have that rich experience, similar to how they see a doctor in person, telemedicine needs to evolve, right? Like on one hand, they need to really provide the cost saving to avoid one virtual visit to turning into a virtual visit plus in-person visit. That's one aspect of it. The other is to truly provide the experience of a monitor and getting data from the patients in addition to a face-to-face chat. So that's both of those trends are really setting stages for growth for our company.
So how does Remmie fit into this overall landscape? Where are you positioned? And tell us more about Remmie.
Yeah, so we are truly solving this problem of doctors not able to see ear, nose, and throat ailments, which account for about 80% of the common acuities that people see a doctor over telemedicine for. And then also for families not able to interpret the symptoms, even if they bought an ear monitor of some sort, they're not able to interpret the symptoms and not able to get those closed loop diagnosis and treatment. So we're truly bridging that gap to offer the families a connected family ear, nose, and throat monitor with integrated telemedicine, and in the future with AI diagnosis assistance to support the doctors. So it is a digital app that images, videos, and text symptom information can be collected by the user at home with a user-friendly monitor, so ergonomic, safe, easy to use monitor. And they can share those during a telemedicine visit in real time with doctors. So on the other hand, when we have our own app, which patients can use to dial up a doctor who are providing telemedicine services through our partnership platforms. And in the meantime, we're offering an API and a software development kit for any telemedicine platforms to kind of integrate our connected device onto their platforms. So by doing a simple technical integration in the back end, they are able to offer this as a benefit to their patients and provide value add to their existing platform. And in the future, there's also a pipeline Remmie.ai program that is patent pending that we offer to the doctors or telemedicine providers so that they can receive diagnosis assistance while they're receiving these symptoms from the patients to provide more accurate diagnosis. So we really are building a platform, and these video visits are where we see the most value.
Great. And so what's the next step for Remmie when you get it out there, and where do you see it going?
Yeah, so we have gotten quite a bit of traction in terms of both on the consumer front, where we sell directly through kind of retailers. We have our own store and offering the product directly to customers, and we'll be talking with major retailers, building contracts to sell it through their shelf or online stores. And we also are talking with telemedicine partners, schools, healthcare institutions, payers, anybody who may be interested in either generating additional revenue from new patients that we can refer to their platforms, or integrating in the back end to provide additional enriched telemedicine experience to their customers, or cut costs, essentially reducing unnecessary customer or patients in-person visits or ER visits, for example. So we do have contracts pending with a few of those partners in the space through reselling, co-promotion, technical integration, as well as distribution. So those contracts are being negotiated. We do have pretty good contract traction in both the retail and business-to-business directions.
Great. Well, in the last few minutes that we have here, what else should we cover that we haven't?
Yeah, we are really looking for raising a seed round of funding. We were pre-seed funded, and now we are at a stage where we're scaling up and grow really rapidly. We've gotten such great responses and traction in terms of the customers that we reach out to, and the percentage, 70-80% of the customers we reached out to are truly interested in talking more and talking further. We are looking to build a quality product. So the seed money will really drive kind of technical improvement on building better and higher quality products for our customers. And we really wanted to prioritize building partnerships with retailers and telemedicine partners. So anybody who is interested in funding us in terms of seed round, please reach out to us. And we're looking for $1.5 million in seed funding, convertible notes, and we are very open, have those investor relationships in this rapid growth period of our company. Thank you.
So how best for listeners to get back in touch with you?
Yeah, you can definitely look up our website, RemmieHealth.com. We also have pretty good social presence on Facebook, Twitter, LinkedIn. And obviously, feel free to reach out to me directly through email, jane@RemmieHealth.com.
Great. We'll put those in the show notes. We want to thank you for joining us today. Hope to have you back for a follow-up soon.
Thank you. Thank you so much. Appreciate it.
Investor Connect helps investors interested in startup funding. In this podcast series, experienced investors share their experience and advice. You can learn more at investorconnect.org. Paul T. Martin is the director of Investor Connect, which is a 501c3 nonprofit dedicated to the education of investors for early-stage funding. All opinions expressed by Hall and podcast guests are solely their own opinions and do not reflect the opinions of Investor Connect. This podcast is for informational purposes only and should not be relied upon for the basis of investment decisions.